We're rolling. Action.
Hi, my name is Kelly Munoz, and I'm going to be talking to you about shingles today. Here's my audience.
And me.
Alright, do you know that as an adult you can acquire shingles, which is also known as herpes zoster, from having chickenpox as a child? You can even get shingles from getting the vaccination because it is a live virus. As a medical assistant for 15 years, I have seen a lot of children with chickenpox and a lot of adults with shingles. First, I'm going to tell you some general information about shingles, and then I will tell you about what symptoms to look for and the appearance. Last, I will tell you how shingles can be treated. I'm going to start out by telling you some general information about shingles. First, I'm going to talk to you about transmission. Shingles can never be transferred from person to person. However, a person that has not had shingles or chickenpox in the past or had a vaccination could become infected with the chickenpox from the shingles. This can only happen if exposed to someone that has shingles, that has blisters that have erupted. Newborns, immune-compromised, and pregnant women are the most susceptible to the virus. You can develop shingles later in life only from a reactivation of the varicella zoster virus. You cannot catch it. Vaccination recommendations for children for chickenpox and shingles are as followed. For children, it is recommended that they get their first shot of the varicella, aka the chickenpox, from ages of 12 to 15 months, and the second at the age of 4 to 6 years. Adults should get the Zostavax injection for the prevention of shingles at the age of 60. Next, I'm going to talk to you about what kind of symptoms you can expect to experience. Pain is the first thing people will experience with shingles. Typically, within a few days after the pain, a rash will start and will appear. Since shingles lie dormant in nerve roots, the rash will appear in a band-like shape that generally appears around the trunk of the body, and it will not cross the midline. Some people will experience a rash that has blisters that will crust over and that will heal, usually within 2 to 4 weeks. Some will get a pain with no rash at all. Some other symptoms that people can experience are fevers, headaches, and flu-like symptoms. People can develop some complications from shingles. First one is blindness. It can result when shingles develops around or in the eye. The second complication can include neurologic conditions such as the most popular called post-traumatic neuralgia. This is where you will continue to have pain where the shingles were even after they're gone. Other neurologic conditions can include the brain becoming inflamed or facial paralysis. If the blisters or wounds are not taken care of properly, they could become infected, which would give you a secondary infection. Next, I will talk to you about some treatments that are available for shingles. Since shingles is a virus, you will need an antiviral medication prescribed. The most popular treatments include valacyclovir, acyclovir, and famciclovir. Some people will have so much pain that they will need pain medications prescribed to them. It's up to the physician as to which ones they prescribe for that. First, I told you some general information about shingles. Second, I told you about the symptoms and the appearance. And finally, I told you about treatments that were available. In conclusion, if you start feeling pain with no injury or a painful rash, make sure you see a physician as soon as possible to get started on medication. By doing this, within the first 72 hours after the rash appears, you can shorten the duration of the pain and the virus. Also, if you have shingles or open wounds, make sure that you're very careful because you can be contagious to people around you. The two resources I used was the Center of Disease Control website and also the Richland College Library website, which was called Herpes Zoster, Epidemiology, Clinical Features, Treatment, and Preventions. Thank you. Here's my audience again.